Addiction therapy, depending on the therapeutic approach used, may take different levels of focus. If the therapy focuses on dealing more effectively with underlying stressors, which the addiction is being used as a coping mechanism for, work with the platform will more closely resemble the aversion work previously described, and either way the basic workflow will remain the same. On another level of focus, experiential work can be helpful in reenacting moments that the participant has found challenging in terms of resisting addictive urges in day-to-day life, and highlighting the choice points that sometimes might not be fully noticed or utilized in those moments. Some addictive stimuli will be a little easier to visually represent, such as a single cigarette or a box of cigarettes for someone who has a smoking addiction. Others might be more complex or situational, like gambling or shopping. The platform provides the option for complex stimuli to either break them down into simpler constituent parts or to represent them symbolically. It may be that the participant already has an iconic, evocative way of representing the issue, a scrunched-up betting slip or a bill from the credit card company. If not, co-creative work can take place to establish a symbol that either points at relevant addictive stimuli or to the various thoughts, feelings, and behaviors that give rise to the addictive habit. Taking the example of a smoking addiction, the cigarette or the pack can be depicted in the space using a simple geometric shape or a 3D model. If context is an important factor, then other assets or an immersive scene can be loaded to create a greater sense of place. The participant, with the guide support, can practice noticing a choice point at moments in the past when they would have reached for the cigarette. Other more suitable responses can be explored and also visualized in the space. Choosing a healthier option can be practiced spatially, with the participant moving away from the unwanted stimuli, the cigarette, and towards an alternative choice, creating a physical, spatial, and visual experience to help with reinforcement. Features of objects in the space, such as their scale, color, or proximity to the participant, can also be used as a helpful visualization tool to indicate the participant's current affective stance towards that item. The cigarette, for example, may be made to appear much smaller after therapeutic work has taken place, and the positive alternative larger, to represent relative significance. A greater narrative emphasis might be taken if the guide chooses to use a form of aversion therapy to help create a mindful awareness of the consequences of continuing down a particular addictive path, with a comparison to the positive benefits of following the path of the alternative. The ability to visually depict this in space and to physically walk that path can help make what can seem unfamiliar and abstract more concrete and imaginable, and the choice points that lead there more recognizable. The platform places an emphasis on giving control to the participant and guide, so there is the freedom to make the contents of the experience room as simple or as sophisticated as is needed, from drawing a simple picture on a virtual canvas through to spatially navigating the consequences of different choices. More elaborate projects will likely be built over time, starting with simple options, then later representing and working through challenges that the participant has experienced between sessions.